How do you determine which is left and which is right when it comes to your ultrasonic inserts? So there's a couple ways. One way you can do it as you're laying on the tray. One way you can do it on the mouth, which we'll show you as well. But when you're laying them on the tray, make sure the tips are towards your tray or your table or whatever. Then your stacks, have them facing towards you as a clinician. And when you look at them, whatever way they're curving is the insert they are. So if you see this one is going left to me as the clinician. So this one's gonna be our left insert. This one's curving to the right. This one's our right insert. And the nice thing about these curves and the bends, they can really adapt to roots and furcations so much better than a straight insert. Let's see it in the mouth. So how do you determine which is left and right in the mouth? So what I like to do is I have the handle coming out of the mouth and I'm gonna put my tip onto the tooth like that. Okay, once it's angled like this, then you can test it into the pocket. So when your instrument is in the pocket, it should curve out of the pocket. This is the incorrect insert for this buccal side. But if I put it here into this lingual, you see how it's kind of curving out of the pocket, coming more towards the tongue. This will be the correct insert for this lingual side of quad 3. And the reason why is because if I use it on this buccal here and I try to adapt, now that tip is just going to be on the tooth and may potentially gouge and cause issues. Ideally, we want it as we adapt, it's the side of the insert is on the tooth, not the tip. For me to get the tip of the insert, I'm going to have to be like all the way like this, which is impossible in a mouth. So you want the insert coming out and wrapping out of the pocket just so you're adapted correctly. So this one's our right insert, and then we're going to be able to use it right here on this lingual of quad 2. So now we've determined that this left and right insert, this is the right, so we're going to use it on this lingual of quad 3, but where would I use it on quad 2? So if I flip it around, it's going to be on the buccal of quad 2. And then if I'm going to use it in quad 1, it's going to be the lingual. So it's going to be all these surfaces away or towards, depending if you're left and right or right-handed. And then on the bottom, it's going to be the lingual. So then in quad 4, I'll be on the buccal with this insert. So these are super specific to where you're using them, but the nice thing about them, because of that, you can adapt so much better than your traditional straight tip, and you can really get subgingivally into these deep pockets and remove that biofilm and calculus that's way deep down there.